Hello, we will be doing a newborn assessment on this baby doll. We're going to start with just her general appearance. We're just going to kind of look at her skin tone and make sure it's nice and pink. We're going to make sure her posture is flexed and her movements are bilateral. So she's moving all of her extremities bilaterally. And we're going to be looking for anything out of the ordinary, such as stork bites or erythema or any cuts or scrapes or abrasions or anything like that. So what we're first going to do is we're going to look at her head, and we are going to measure the circumference of her head. And the normal circumference for a newborn is going to be between 32 and 38 centimeters, which is about a quarter of the length of her entire body. We're going to look at her hair. We're just going to feel her hair and make sure it's nice and fine. And then we're going to find her interior fontanelles. It's going to be in a diamond shape right on the top of her head. We're going to make sure that's smooth and flat. And then we're going to check the posterior fontanelle on the back, and it's going to be more of in a triangular shape. We want that to be soft and flat as well, making sure there's no caput succedaneum or any cephalohematomas. Good. Turn the baby around. And now we're going to check her facial features and make sure they're symmetrical. We're going to check her outer canthus of her eye and make sure it matches up with the top of her ear or her pinna of her ear on both sides. And it does, which is a normal finding. And then we're going to check her nose and make sure it's symmetrical. And we're going to note the color of her eyes is blue. And we're also going to check her pupils, make sure they're equal, round, and reactive to light and accommodation. And the infant is Perla, 3 millimeters. Now we're going to check her nostrils. Infants breathe out of their nose, so what I'm going to do is I'm going to cover up her right nostril and kind of close her mouth and make sure that her nostril is patent. So air is coming in and out and she's breathing, and she is. I'm going to cover the other one and do the same thing. And air is able to move in and out and she's still breathing. Now we're going to check her mouth. And the first thing you want to look at for her mouth is to make sure it's pink, and also that it's moist. We're looking for any circumonial cyanosis, which would be a blue ring around her mouth to indicate low oxygen. And she's perfectly fine. She's got a nice pink moist mouth. And we're going to start with the rooting reflex, which is I move the side, I touch kind of the side of her cheek here, and she turns towards the stimulus. And I'm going to do the other side, and she's going to turn towards that stimulus as well. Now we're going to inspect her mouth for anything out of the ordinary, any abrasions, any hematomas, anything like that. We're looking for Epstein's pearls or teeth or anything like that you normally would want to notify the healthcare provider about. And her mouth is nice and pink and moist. Her tongue is moist, and I don't find any teeth in her mouth. Moving right along, we're going to check her neck. Her neck should be short with thick skin folds, and she should be able to move it easily from side to side. Good. We're going to make sure her trachea is midline, and it is. We're going to move on down to inspect her clavicles. We're going to inspect these for fractures or any lumps. We're going to palpate them to make sure they're intact. And we're going to notice that her chest shape is cylindrical, and that her nipples are pink, and that her nipples are symmetrical with her chest, and it measures 30 to 36 centimeters. And we're going to notice that her abdomen is soft and round and symmetrical. And we're going to take a look at her umbilicus, and we're going to look to inspect her cord. We're going to make sure, if we can, that there's 2 arteries in 1 vein, and that the color is a bluish white. And just to note that it's going to get darker within the coming days. We don't see any redness, drainage, or discharge, or anything abnormal. It looks nice and intact. As we move down to her genital area, we're going to inspect her. This is a female, so we're going to make sure her labia is edematous, and notice that there's vernix present in her folds, which is a normal finding. If it were a male, we would be looking that the scrotum is bilateral with the testes intact. We would also want to observe for any aspidias or hypoaspidias. And we're going to go ahead and turn her around. And we're going to observe her anal area and make sure there's no fissures or anything abnormal in that area. And it looks nice and normal back here. We're going to go ahead and check her back to make sure it's straight and flat. We're going to be looking for any tufts of hair over her spinal columns that could indicate a spinal bifida, and I don't see any hair. We're going to look in her sacrum area, look for any dimpling, because that might indicate pilonial cysts. We're going to go ahead and check out her buttocks and make sure that the folds are symmetrical and her legs are equal in length. And they are. Okay. Now we're going to check her extremities. We're going to start first is the Mora reflex. This is the startle reflex. We're going to lift the baby. And the hope is that her arms will abduct, meaning go out to sides as if she's trying to stop herself from falling. And her fingers form a C position. Good. Now we're going to look at her ankles and feet and check for any club feet or any webbing between the toes. And we don't see any of that. We're going to also count her toes, and she has 5 on this foot and 5 on the other foot. We're going to go ahead and do the plantar grasp with the toes. So what that entails is when I put my finger underneath the toes will curl around my finger. Good. Good. Now we're going to do the Babinski reflex, which is the toes will hyperflex when I run my finger across the ball of the foot from the heel to the toes. Good. Good. We're also going to do the plantar grasp with the fingers. And when I put my finger on her hand, she grasps my finger. Good. Good. We're going to check for hip dysplasia. We're going to rotate her hips with knees flexed. And the abnormal finding would be a femoral head slipping from the acetabulum. This would be an Ortolani sign indicating that she has a dislocated hip. You'd probably hear a clicking sound. And I don't hear anything. And the baby's not crying, so this is good. Okay. Now we're going to look for her breathing. So we're going to count her respiratory rate, and I'm going to do that for 1 full minute. And for purposes of this video, I'm not going to do it for 1 full minute because it's a doll. But the normal respiratory rate for an infant would be between 30 and 60 respirations per minute. and she had 50. Now I'm going to check her, her chest movements to make sure that she's breathing okay. We want to look for any retractions. We want to look for any flaring of the nostrils, for any grunting, or any asymmetrical expansion of the chest, because that indicates that the baby is in respiratory distress. We don't see any of that. We see a very relaxed baby, which has very normal breathing pattern. Now we want to check her heartbeats. And I'm going to count this for 1 full minute, but for the purposes of this video, I won't be. A normal infant heart rate is going to be between 120 and 160 beats per minute. And hers was 137, so that's normal. We're going to go ahead and palpate the brachial pulses. We're going to also move along to the femoral pulses. And also, it's not typical to check a baby's blood pressure unless it's needed for some reason, but a typical blood pressure would be 65 to 95 systolic and 30 to 60 diastolic. But for the purpose of this video, we will not be checking her blood pressure. Thanks for watching.